know what acupuncture is, but have you ever heard of dry needling? It's a similar type of physical therapy for pain. And this morning we have Mike Morris and Mary Brunet from Back in Motion. So nice to have you guys here. And they're going to tell us exactly what this is and how it works. And I guess you're going to do some talking and you're going to do some sticking. I'm going to do some sticking. Okay, all right. What do we have? What's the difference between this and acupuncture?
Well, dry needling and acupuncture both use the same type of needle, and you're going to see it's a very, very small, thin monofilament.
And you can go ahead and start doing what you need to do, Mike.
And so the difference between the two is the purpose for using them. In acupuncture, it is based on changing the energy levels in the system, in the system of meridians throughout the body.
Okay.
So the yin and the yang and balancing those. Whereas dry needling is basically trying to penetrate the skin over a trigger point.
Okay.
Over a trigger point so that the muscle will let go and it'll increase the circulation to the area.
Great.
That's the difference between it too is PTs use that as only one part of our whole gamut of all the tools we can use to help the person improve.
Okay, and if you get the blood flowing into that area, the idea is the blood is going to fix your problems as it flows.
Well, that's part of it. The muscle will let go, it'll release, and then that will allow us to do more afterwards. Like we can do some joint mobilization, exercises for strengthening, for stretching, and take advantage of the new things.
That's okay. I'm ready. Let's do it.
All right, you're going to feel a click. You're going to hear a click. You're going to feel a little prick and maybe some aching into the arm.
Okay. Wait, you didn't say that.
Well, some people will feel something. It may feel a little sting.
Actually, I barely felt anything.
Yeah, that's common too. And then, as Mike was saying, some people, after it's in there, they may feel a little bit of an ache, but it'll go away very quickly. Because that's always people's concern. Is it going to hurt? Is it, what's it going to be like?
Is the ache an indication that it's actually doing what it's supposed to be doing?
Yes, it is.
Okay.
Yeah.
Okay.
And the therapist is always palpating to find the trigger points. That's the part of it. You can't just put it anywhere. To be effective, you want to get the trigger point involved in the area.
Is this a one-time thing, or is this a comeback once a week for a month kind of thing? Or
well,
what do you think?
Again,
now that one I felt more. Interestingly enough. Okay.
We use it as part of our treatment. When we see patients, they come 2 to 3 times a week, and you can do it depending, again, it's only part of the treatment. So once things are changing, then you can stop doing it. Mike had a patient who he saw recently, tennis elbow for 10 years. He came in for PT, and Mike added in the dry needling, and within 5 weeks, he was basically pain-free with the other treatment, though, as well.
Is this something that is generally covered by insurance, or is that an iffy thing? Or?
Yes, no, because physical therapy is covered by insurance, so it's part of our treatment, and so it is included in that. It's just one of our modalities that we can use.
Okay, and one last thing, how long would these things stay in here?
Anywhere from 5 minutes to a half an hour.
Okay, okay. Not painful at all, I will say. I felt a little prick the second time, but nothing even problematic at all.
And sometimes you'll feel afterwards for some muscle soreness, just like you had exercised, for up to a day, maybe 2.
All right.
Sometimes I leave them in there, and sometimes I jostle them back and forth and do some pecking and some counting. But, 5 to 30 minutes.
All right, awesome. Thank you guys very much. Really interesting. It's all online, too, if you want to see more. We're right back after this.